All right, welcome back to ABA exam review and the continuation of our RBT practice questions series where we're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack and practice exams. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Tony starts as the new human resource management group of veterinarian clinics in her city. Tony wants to establish a bonus structure for the employees, but first she wants to evaluate what each employee values most when they receive a reward. She sits down with each employee and talks with them for about 15 minutes. What best describes Tony's strategy of sitting down with each employee to find out what they value? Interesting question here. We're looking at Tony specifically and her strategy. And what is her strategy? Well, she's going to sit down with each employee to find out what they value. Now, why would Tony do that? Well, Tony is now working for this group as a human resource manager, and she wants to establish a bonus structure for the employees. In other words, some sort of reinforcement system. However, Tony's smart about it, and before she establishes that reinforcement system, what does she do? Well, she evaluates what employees value the most. And why does she do that? Well, think about it in terms of maybe clinical work. Let's say you have a group of clients between 5 and 7 years old. Are all those clients going to like the same thing? No. Are they all going to prefer the same thing? No. Are they all going to be motivated by the same thing? No. So what do we do prior to giving different clients different items and toys? Well, we do preference assessments because we always want to know what do they prefer before running any sort of reinforcement assessment or designing a strategy. Everything's individualized. So Tony, prior to the reinforcement system, decides I'm going to find out exactly what they value. And how is Tony doing that? Well, she's going to sit down with each employee and ask them. So when you sit down with somebody and ask them questions, what kind of assessment is that? A single choice preference assessment. Is Tony actually presenting item after item after item? She's not. She's just talking for about 15 minutes with these employees and just picking their brain. What do you like? What do you value? What about a free operant preference assessment? Well, with the free operant preference assessment, the assessor or the observer watches the learner or participant in their natural environment. Tony's not actually observing anything. She's sitting there and talking with them. What she's doing is a sort of indirect assessment. She's not actually watching what the employee engages with. She's asking them questions. So an interview style assessment. And interview style assessments are most commonly indirect. It's not a complete functional behavior assessment because with a complete functional behavior assessment, you would need direct assessments and even functional analyses. Tony isn't doing any of that. She's sitting down with the employee, talking with them, interviewing them about what they value. Tony is using an indirect assessment to determine what do my employees value. Then she can start to put together her bonus structure. Pedro is running for office and creates a campaign slogan, Vote for Pedro. His friend Napoleon helps hand out flyers and promote Pedro. After the polls closed and the votes were counted, it turned out that 60 out of the 80 voters did vote for Pedro. What percentage voted for Pedro? This is a simple percentage question. Remember, you need to know how to find averages, totals, and percentages. Okay, and very basic, simple math, but you might have to practice it a few times. If it's been a while or maybe you're unsure, you have to know how to do it though. So here we're going to find a percentage. And what is our percentage? Well, our percentage is how many people, how many voters voted for Pedro. And right here, it says 60 out of 80 voted for Pedro. So to find that percentage, you take your frequency count, right? 60, or your data collection, whatever data you collected on the behavior, and you divide it by the total number. So in this case, we have frequency. So 60 voters divided by 80 total, and you'll get 0.75. To get a percentage, you just multiply that by 100. And there is your percentage. It's not 60 or 80% because that's just your frequency. It's not 25%. 25% is the voters who didn't vote for Pedro. We're looking for the percentage that did vote for Pedro. So we take our total frequency count, divide it by the total possible votes, multiply by 100, and we get 75%. And that would go for any data you collected, right? What is the possible? What data did you collect? You divide the data you collected by the possible and multiply by 100. That is your percentage. Again, very straightforward math. Most of you likely already understand this. That's great. If you don't, it's not a problem, right? Just practice it a few times until you're comfortable with it. You have to know totals, percentages, and averages. Gloria will sometimes start to scream loudly while playing with her big sister. When Gloria screams, Gloria's sister will stop playing with her and will only start playing with her again once the screaming stops. What is Gloria's sister using? So we have Gloria and her sister. As always, whose behavior are we looking at? We're looking at Gloria's sister. So we know that Gloria will start to scream loudly while playing with her sister. When Gloria screams, what does Gloria's sister do? She stops playing with her and only starts playing with her again when the screaming stops. So we're looking at some sort of differential reinforcement. What is the first question we ask ourselves with differential reinforcement? We ask ourselves, are we teaching a replacement behavior? As a RBT and for the exam, you'll likely only need to know differential reinforcement of other behaviors, alternative, and incompatible. If you aren't teaching a replacement, it's going to be a DRO because alternative behaviors and incompatible behaviors both teach replacement behaviors. Is Gloria's sister teaching a replacement? Well, no. She's simply stopping and not providing reinforcement until Gloria isn't screaming. So she's reinforcing in the absence of a behavior. And the behavior in this case is screaming loudly. So A, differential reinforcement of other behaviors, is exactly what Gloria's sister is using. That DRO strategy, where you reinforce when a behavior isn't occurring. So the target behavior is screaming. Gloria's sister is reinforcing. As long as screaming is not happening, that is DRO. B and C, alternative incompatible behaviors, Gloria's sister would need to be teaching a replacement, but she's not, because an alternative behavior strategy, you teach an alternative to the screaming. An incompatible behavior strategy would teach an incompatible behavior to the screaming. You're doing neither. You're reinforcing, or Gloria's sister is reinforcing when the behavior isn't occurring, making it a differential reinforcement of other behaviors. Obviously, D is not our answer, higher rates of behavior. It is a type of differential reinforcement intervention, but with higher rates of behavior, you're trying to increase the target behavior. Here, Gloria's sister is trying to decrease it by no longer playing and giving it reinforcement for the screaming, but she's not necessarily teaching a replacement. So since she's reinforcing in the absence of the behavior and not teaching a replacement, that's going to be a DRO, or differential reinforcement of other behaviors. Julian will sometimes jump up and down and flap his hands while engaged with his math homework. Which of the following answer choices would not be an appropriate way to describe the behavior in applied behavior analysis? All right, so we're trying to describe a behavior. And when we describe a behavior, think about defining a behavior, right? We want our definitions to be objective, clear, and complete. Okay, and some might say concise. Objective is the key here. We need to be objective. And to be objective, we're just describing exactly what's happening. We're not including mental states and feelings and these kind of things, right? We're just describing exactly what's happening. In this case, Julian is jumping up and down and flapping his hands while engaged with his math homework. How would you describe that behavior in ABA? A, Julian engages in this behavior in an attempt to escape from task demands. Would this be okay? Well, yes, because you're just saying the behavior has a reason. The function, in other words, is escaping from task demands. So Julian is engaging in the behavior to escape from task demands. You're simply describing the function of the behavior. A looks good. Remember, we're looking for not, right? It's a not question. B, Julian engages in his behavior due to his autism diagnosis. Do we ever attribute the behavior to the disability? And most of you will work with kids with autism. So do you ever attribute it to autism? No. And why not? Well, we can't cure autism, right? So if we start attributing things to autism, we can't cure autism, we can't change it. So we should never attribute any behavior to the autism diagnosis. Now, is flapping hands a common characteristic of autism? Sure. But if we're talking applied behavior analysis, meaning we're looking for objective, descriptive ways to change behavior, we need to think about environmental, observable factors we can change. The autism diagnosis is not it. So you have to take into consideration, we're talking in applied behavior analysis. What about C? Julian engages in this behavior because in the past his mom offered to help following the behavior. Well, sure, right? Why does Julian jump up and flap his hands? Because in the past, he's received reinforcement from his mom through the use of help following the behavior. So just like A, the behavior serving a function, it's an environmental variable that we can control and change. The autism diagnosis is not something we can control or change. It's not a good environmental variable. It's not a good way to describe the behavior in applied behavior analysis and using ABA terminology. So that's a very important part of this question. How are you going to describe it in applied behavior analysis? You, a behavior technician, are taking duration data on the client's sitting on the couch behavior. You've been tracking this behavior for 2 months. Today, you notice that the last 3 days you've accidentally taken frequency data on this behavior. What should you do? All right, this is not uncommon. We call this observer drift, when the way you're measuring or what you're measuring changes over time. It happens to everyone. It's common. We just have to catch it and fix it. Luckily, you, the technician, caught it after 3 days. What did you catch? Well, you're supposed to be taking duration data on sitting on the couch, and you've been tracking that behavior for 2 months. However, you've accidentally started taking frequency data. Okay, how do you move forward? And remember, when you get into these questions, what are borderline ethics questions, where maybe you've made a mistake or you catch a mistake, what the task list and ethics code want you to do is to communicate with your supervisor. They want you to over communicate with your supervisor. They put so much emphasis on open communication. In this case, you've made a mistake. What do you do? A, attempt to change the data and switch back to duration data moving forward. Well, you should never attempt to change the data. The data are the data. We don't manipulate data after the fact because we didn't like it or there was made a mistake. The data are the data. So A is definitely out. B, switch back to duration data moving forward, but don't tell your supervisor. You definitely want to tell your supervisor. You should never hide this. These are all important things. When your supervisor goes to look at the data, there's a good chance data from those 3 days are going to look very different compared to the other days. And they're going to want to know why. Open communication is key. C, inform your supervisor as soon as possible. Yes, that's your first move. You caught the mistake? Fantastic. Let them know and they'll tell you how to proceed. D, continue taking frequency data, but tell your supervisor. Well, you want to tell your supervisor, but don't keep taking frequency data. You're supposed to be taking duration data. So you're going to revert likely, but instead of making that choice on your own, do C. Inform your supervisor as soon as possible. And that is the rule of thumb for practically anything in these type of situations. Contact the supervisor immediately. When in doubt, communicate with your supervisor. Another way to describe data that was collected on a target behavior prior to an intervention starting would be what? This is essentially a terminology question. So what is the terminology or what is the definition? Data that was collected on a target behavior prior to an intervention starting. That's basically our definition. So let's think about that. Data prior to an intervention starting would be what? What are we trying to determine? Well, we're trying to determine what does that behavior look like. We haven't changed anything. We haven't started to intervene. There's no treatment. We just want to know what that data are and what that behavior looks like. So what about A, baseline data? Well, yes, baseline data is exactly this. When you take baseline, you're getting a sense of what the behavior looks like before you try to change it. So data collected on a target behavior prior to intervention will be baseline data. Why would it not be maintenance or generalization data? Well, maintenance and generalization data are going to come after the intervention. We've already intervened, and if we've withdrawn the intervention, maybe we want to see, did the behavior maintain? Or maybe we do it in a different setting to see if it generalized. So it can't be B and C, those come after. We're looking for something prior. And then frequency data. Well, we're not specifying what type of data we're taking here, so we can't say for sure it's frequency. There's no way to know, right? We're just speaking in general terms. And in general, baseline data are data that were collected on a target behavior prior to an intervention starting. A dad is building Lego cars with his son. He wants to teach his son to identify different pieces. Whenever he wants his son to grab a certain piece, he will say, pick up the flat piece and then move that piece closer to the son. What is the father doing? Interesting question here. We're looking at the father in the scenario. So in this case, he's building Lego cars with the son. He wants to teach his son to identify different pieces. Okay. Whenever he wants his son to grab a certain piece, he will say, pick up the flat piece, the SD, and then move the piece closer to the son. What does that look like to you, moving that piece closer? To me, it looks like a prompt. What type of prompt? Well, positional, right? He's altering the stimulus. He's manipulating the stimulus, the piece, and moving it, positioning it closer to his son. So to me, A looks right. A, using a positional prompt. Let's read all of our answer choices, though, because B, using a stimulus prompt, is also correct. A stimulus prompt acts directly on the stimulus. A positional prompt is a type of stimulus prompt. So the father or the dad is doing both A and B. What about C, using incidental teaching? What is incidental teaching? Well, incidental teaching is just the same thing as naturalistic teaching. It's using naturally occurring settings or situations to teach. And that's what the dad is doing. He's building Lego cars and he's using the opportunity to identify different pieces or using the opportunity of building Lego cars to teach his son to identify different pieces. It's not discrete. It's not contrived. He's just building Lego cars. He needs a piece. He prompts the son. He's trying to teach using incidental teaching. So the father is actually doing D, all the above. He's using a positional prompt. He's using a stimulus prompt, and he's using incidental teaching. Thank you for watching. Please subscribe if you have not already. Check out btexamreview.com for all of our study materials, including our combo pack. As always, when you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.